Hi, my name is Samantha Walker, and I am doing my video for saline moistened dressing change with sterile technique for nursing 101. So the first thing I want to do is to go ahead and check my physician's order to see if this is the type of dressing change ordered for Mr. Johnson. His birthday is 2/12 of 73. The next thing I want to do is go on in and introduce myself and explain the procedure to Mr. Johnson and see if he needs any pain medication. Hi, Mr. Johnson. My name is Samantha Walker. I'll be your student nurse today. I'm here to change your dressing. So that means we're going to take the old bandage off and put the new bandage on, if that's okay with you. Yeah? Okay. Do you need any type of pain medication before we start today? No? Okay, good. Let's go ahead and get started. I do want to check your wrist bracelet. Can you tell me your full name and your birth date before we begin? Yep, Mr. Johnson, 2/12 of 73. Terrific. All right. So the next thing I want to do is screen my patient for privacy. So, Mr. Johnson, I'm going to go ahead and pull back your covers a little bit, okay? I'm also going to go ahead and pull up your gown just so we can see the wound. Okay. I do want to go ahead and do my hand hygiene before we get started and put on some gloves. I am going to remove the dressing. I'm actually going to kind of pull up while I push down. Not pull so much as just push the skin away from the dressing very gently. So then I'm going to get the dressing that's underneath in the overtop dressing. So that way we can see what the drainage looks like. We want to check the drainage for the amount. There's a scant amount. The color, it's serosanguinous. It's a really light pink. And any type of odor. And there doesn't appear to be any. So I'm going to go ahead and put this dressing that's soiled in the biohazard bag. And I'm going to remove my gloves. All right. I'm going to perform hand hygiene again. The next step is to put on new gloves and to measure the wound. We want to know how long it is, how wide it is, how deep it is. We're going to check it for an appearance of tunneling or undermining to see if there's any type of maceration on the outlying skin. Okay. Already took the end off of these swabs just so I can get them out easily. And I'm going to measure it with the little centimeter thing on the side. So we're not going to actually touch the wound, but we're going to see about how long it is. We're going to measure that, 12 centimeters. We're also going to look at the width of the wound. So it looks like that wound's about 2 centimeters wide. I'm going to dispose of that one because the next applicator we're actually going to put into the wound, but we're not going to touch the sides. We're going to measure the depth, and we're going to see how deep that wound is. Okay, looks like the depth is also 2 centimeters. Everything seems to be nice and intact, so I don't want to disturb that new granulation tissue that's forming. There isn't any evidence of infection or swelling going on or redness on the outside of the skin. So I'm going to go ahead and remove my gloves. I'm going to perform hand hygiene again. Can never wash too much. And at this point, I'm going to go ahead and open up my 4x4 gauze, pulling it away from me, and pour in my saline dressing, or saline solution. This is a new bottle, so I'm going to open that up. pour that in, and then pour that in. Then recap my container. I'm also going to sign and date that and time it because it's good for 24 hours. Okay. The next thing that I want to do is to go ahead and create my sterile field. So I'm going to scoot all these things over because I want to have lots of room if possible. I am going to only touch the outside shiny part. And I'm going to pull back away. I'm going to open it up and I'm going to lay that down. The outer 1 inch border of that is considered contaminated. So my goal is to try to get everything into the center of that. I'm going to go ahead and open up my cotton tipped applicators. I'm going to pull those apart. And I'm going to dump that onto my sterile field. Hopefully they'll come out. Okay, there we go. And then I am going to pretend this is closed, and I'm going to open it up, and I'm also going to dump it onto my sterile field. Same for my 4x4s. I'm going to open those up. And dump those onto the field. Open and dump. Okay. At this point, I'm going to open up my surgical gloves. I am not going to put any part of my body over top of the sterile field. And we're going to take extra care with these gloves because it's important that they stay sterile. I'm going to perform hand hygiene. And then we're going to open them up. Okay. I'm going to start with my dominant hand. So I want to go ahead and start with the right one, and I'm going to grab the glove by the cuff, and I'm going to put my hand in the glove. Okay. And for the next one, I'm going to use these 3 fingers and slide it up underneath of the cuff. We only want to touch sterile to sterile. Okay. And so we have our gloves on now. So I'm going to go ahead and pick this up and move it out of the way. So the other thing that I want to do is to go ahead and clean my wound next. I'm going to keep my hands between my shoulder level and my waist level at all times. So I'm going to pick up a moistened 4x4 and I'm going to clean the wound from top to bottom. Dispose. Another 4x4, top to bottom, dispose. Then I'm going to get one of my my wipes here that are dry, and I am going to dry the wound top to bottom, one swipe, and get another dry one, and top to bottom, one swipe. So the next thing I want to do is get a moist I want to squeeze that out real good because I don't want too much wetness inside the wound, and I'm going to fluff it. And I'm going to insert that into the wound using my sterile cotton applicator. You don't want to pack it too tightly, but you do want to ensure that you're getting it into the wound. So it's not touching the outer edges, because you don't want to have maceration of that outside tissue. So I'm going to dispose of that. Then I'm going to pick up a clean 4x4, and I'm going to place that on top of the wound. My other clean 4x4 on the other side of the wound. Okay, hold this in place. I'm going to reach over here and get my ABD pad, and I'm going to open that up and put that on the wound. Okay. So at this point, we have a sterile dressing in place. So I am going to get my tape and my scissors. And I am going to put the bandage in place. Just light, gentle pressure to hold it where it needs to be. Get the first piece on so it doesn't get away from us. Nice, even, gentle pressure. Okay. I'm going to go ahead and remove my gloves at this point because it's just easier for me to cut the tape. And put those in my biohazard bag. And I'm going to go ahead and finish taping up this dressing. Just seal those edges. Keep everything out. And keep that moisture in. The next thing that I am going to do is sign and date my dressing. So I'm actually going to do this on tape, and then I'm going to put an extra piece of tape on there. So there also are other wounds on this mannequin. I would never place tape or a dressing over the pressure ulcer type wounds that are on there. So I'm going to put my initials and the time and the date. I'm going to put that here on the edge of the dressing. I'm going to go ahead and help my patient get covered back up. How are you doing, Mr. Johnson? You feeling all right? Yeah? Okay. Don't need any pain medicine? Okay. So we're going to go ahead and make Mr. Johnson comfortable. We're going to get him his call bell. We're going to lower his bed. I am going to document what I have done. I'm going to document the date, the time, and my initials that I'm the person who changed his dressing. I'm going to document the dressing, appearance, color, odor, amount of drainage, as well as document the way the wound looked, that there wasn't any tunneling or undermining, that it had granulation tissue, there was no maceration or evidence of infection. So at this point, I would clean up and dispose of the biohazard materials appropriately and finish up by unscreening my patient. I'm going to come back and check on you in just a little while. If you need anything before then, please call me with the bell, okay? All right. Thanks so much for your time. This was my aseptic dressing change.